Good afternoon. I am Dr. Gupta, neurosurgeon from SilverStreak Multi-Specialty Hospital. Today we are going to talk about the brain tumor. The early the diagnosis of the tumor is made, the chances of recovery and the better results is there. So there are many common complaints which we have in day-to-day routines, which are being overlooked. In a fear to go to doctor, a doctor will advise lot many tests and how the test can be done. And few people have a claustrophobia related to MRI, so they do not want to approach the doctor. But there are few things which you all should know related to this brain tumors. Now, the brain tumors has a different manifestation. Uh, we'll be talking about the early signs which you should not ignore. So the first most common cause is headache. Headache is in day-to-day practice. We all have a headache for some or other reason. They can be because of the simple anxiety. They can be over disturbance in the stomach. Can be because of the associated fever. Can be associated with the hypertension. Can be associated with the sinusitis. But any headache which is persistent, and is not getting relief by the simpler treatment you are taking, can be an early sign for a brain tumor. Any headache which is associated with nausea. Nausea is subjective feeling of vomiting. Now, this nausea is very important. If we see the patients of the brain tumors who have a vomiting, in cases of the brain tumor, the vomiting is projectile. So, if you are having a nausea and you have no explained reason why the nausea is there, especially a headache, it can be a early sign for the brain tumor. Visual disturbances is very common, and these are the disturbances whenever they occur to the patient. They most certainly go to the eye surgeon, and eye surgeon examines the eye, and if the eye surgeon is very focused over eye, there are chances that the signs of the early brain tumor can be missed. There are few specific sites in which tumor can lead to the visual disturbances, like pituitary. If the pituitary tumor is there, suddenly you will stop seeing one half of the vision, and or one quarter of the vision, and these are the very early sign of the pituitary tumor. In similar case, if you have some tumor in an area in a brain where we call it occipital area, where all the visions imaging goes, you can have a disturbance in the vision. Similarly, any disturbance to the visual pathway because of brain tumor, you can have a visual disturbances. The fourth point is weakness. Any part of the body on the right side, left side, hands, legs, if there's a weakness, then you should always consult the doctor at earliest possible and get the investigation done. Because any brain tumor which is on the motor cortex will lead to the weaknesses. Then comes down to the numbness, sensation in the hand. If any brain tumor is involving the sensory area of the brain cortex, the patient is likely to have these symptoms. Speech disturbance is a very important symptom. If the patient starts complaining of speech disturbances, either patient is not able to speak properly or patient is not able to speak continuously, patient is not able to comprehend the command. So these are the early signs of the brain tumor which need to be investigated. Then one can have a loss of consciousness. It can be in form of simple fainting attack, or it can be in the form of epileptic fit. If any of the symptom arises, one should not take it lightly. One should go and get the investigation done at earliest possible. In few patients, like in older ages, when they are hard of hearing, people think that because this of the ear disturbances, and they most of the time consult the ENT doctor also. But I like to tell you that there's a one brain tumor which involves uh, hearing nerve. We call it acoustic neuroma. That can lead to the decrease in the hearing, and that again, if diagnosed in the time, we can diagnose the acoustic neuroma in a earlier stage. When the size of tumor is small, we can diagnose and accordingly start the treatment for the things. Behavior changes. Behavior changes, another one very common problem which is missed, and this is most of them attributed to anxiety or psychiatric disturbances. When the patient attendants, they take the patient to psychiatrist, or they take patient lightly, and they, because they start giving the drug which is available on the counter like alprazolam, clonazepam, and they take it very lightly. But there are many brain tumors which lead to the change in the behavior. If their patient are being investigated, the early diagnosis of tumor can be made. Similarly, if a patient is having memory disturbances, and if a particular if it is patient of old age, most of the people think that patient is having Alzheimer's disease or dementia, and these dementia can be an early sign of the brain tumors in few patients. So when we talk of the early brain tumor signs, the multiple common symptoms which can give you an indication, alarming sign. And if you go for the proper investigation, patient can be diagnosed and can be taken for the proper treatment. Similarly, if you patient comes with a difficulty in walking or feeling of imbalance, and feeling of imbalance is very common in the brain tumors which are there in present in the posterior fossa of the brain. So if you find this problem, most of the people say that the patient is having disturbances, balancing disturbances, or different things. But if we have to diagnose a brain tumor, then we have to be very focused and try to get the investigation as early as possible. So if I tell you the one by one, the point is which are the few early signs you should never ignore is one of them is a headache. Headache, any persistent headache, not getting relief by the normal medicine. Number two is nausea of unexplained reason. Number three is changes in the vision. Number four is speech disturbances. Number five is behavior changes. Number six is loss of consciousness. Number seven is decrease in the hearing. Number seven is seizure episode. And number eight, change in the balance. The patient is not able to walk properly. Number eight is tingling, numbness, sensation in the limbs. And the last is weakness of the any part of the body. So what are the advantage of identifying the early warning sign of brain tumors? See, the brain tumor can be classified in the two parts. One is a malignant, other is a benign. Then the size of tumor is very important. One tumor is a small and other tumor is a larger. Then third part is the neurological state of the patient. Now, these three things, they decide the treatment part and ultimate result of the patient. If we are treating a patient who is preserved, who has got a lesser neurological deficit, patient is conscious, chances of treatment going to be the best. In compared to the patient who has already developed neurological deficit, patient is already unconscious, the results are not that good. Second thing is that the patient is has a benign tumor is small, there are lot many new treatment modalities that have come up, like gamma knife, cyber knife. The in patient, like if a patient has a gastric tumor which is smaller, patient has a pituitary tumor which is smaller, one can go for the gamma knife or cyber knife. So these are few things which everybody has to look after and take care of their themselves or their relatives so that they do not land up in a severe problem. The early we are able to diagnose a disease, the better it is. So in SilverStreak Multispecialty Hospital, we have all facilities for the early diagnosis of the brain tumor and the treatment also. I am a neurosurgeon. I'm from PGI Chandigarh. I have an experience of 30 years in treating brain and spine diseases. I'll recommend that you should all subscribe to this Facebook Live. You can put your queries on the chat box, or you can put your queries on the Facebook website. You can call number 012 432 for any query. Now, Vishal Well is asking, can lifestyle factors like mobile use and stress cause brain tumor? See, stress has nothing to do with the brain tumor. But mobile, definitely there were the times, initial studies have come almost 12, 13 years back, in which it has been blamed that the mobile waves, they lead to the tumors in the hearing now. But that has not been proved 100%. But still, we always avoid patient to that they should avoid using a mobile continuously on the ear. And especially if you're using a mobile also, you should not be using the initial few seconds. Like you're making a call, the initial bell goes, your phone should not be near your ear. Saganegi is asking, can children or young adult also get brain tumors? Yeah, definitely. Brain tumor has no age bar. Even the neonates who are just born, they can be born with a brain tumor. Only thing is that we should have early diagnosed disease so that we can treat the disease and give the best results. Vishal Tiwari is high and we speak about the tumor in kid under 5 of the age, especially when you can't express. Yeah, definitely in a age group when the patient or child is not able to tell us, communicate to us the symptoms, it is difficult to diagnose a case. But there are few things in which we can observe in the kid. One is the imbalance. Whenever the child walks, you can see the imbalance. Child will try to fall on the one side or will not able to walk straight properly. Secondly, weakness of the one part of the body. Any part of the body can be weak, right side, left side, hand or leg. That has to be monitored. Third, patient may be having a multiple fits, epileptic fits, which can manifest as symptom. Thirdly, that the patient is a small age, like patient is less than 1 year, you can have see the large head because of the obstruction or tumor in the brain. The head keeps on increasing, so you'll find a patient with a large head. And as the child grows, you can see if the like child is of 4 years, 5 years, you can see the deterioration, the mental working also of the child. And There's a many, it has been seen that the behavior problem which we find in the old age also, they can be seen in the child age reports with the memory disturbances. So you have to just keep a watch on the symptom. You have to be so that you can diagnose the brain tumor in an earlier stage. Age can be any. Ram Mishra is asking, are the symptoms different in man, woman, and child? In a man, woman, and children, there's not much of the symptoms. The few symptoms which occur especially in only women like lacturia, the milk from the breast. It occurs only females because females, whenever there's a pituitary adenoma, it's a secreting adenoma, then one can have a secretion on the breast. Anyone, you are free to ask the question here also. I'll I'd like to thank you all people for joining the Facebook Live. I'll request you that you all can connect on the telephone and the landline number which is scroll here. You can visit SilverStreak Multi-Specialty Hospital for the consultation and for more education stuff also if you want to learn more about the brain and spine disease. Thank you.